Welcome, everybody. Really excited to have you here. This is the last session of the online learning labs for ANH Academy Week 2025. We've had a really great lineup of labs this week with many great activities and new learnings and connections. So I'm really excited to end it on a great note here with this lab, leveraging the cost of a healthy diet indicator for policy impact, tools and visualizations for policymakers. I'm Alex Knuppel. I'm the technical manager for this session, and we're joined by a great crew of facilitators from the Food Prices for Nutrition Project, Anna Herforth, Rachel Gilbert, Oluwagbemi Sadiq, as well as Olatayo Adeyemi, who's a nutrition consultant as well. So thanks again so much. I'll hand it off to the team here to kick things off.
Thanks, Alex. And my name is Anna Herforth. I am the co-director of the Food Prices for Nutrition Project. And we're so glad to be here doing this learning lab. We've been doing this for many years. And if you've come to learning labs in previous years about cost of a healthy diet, this year is a little bit different because we're going to be focusing more on how to use these indicators for policy impact. And here's some great examples of that coming from Nigeria. And I'd also like to just before we get started, take a moment to introduce ourselves. So again, I'm Anna Herforth. Rachel, maybe you're next on the list, so maybe you can unmute and introduce yourself so everyone knows who the team is.
Yeah, sure. Hi, everyone. Good to see you. I see some familiar names here from previous years. My name is Rachel Gilbert. I'm a program officer for Food Prices for Nutrition at Tufts University, and I'm based in Boston, Massachusetts. I'll give it to Benga.
Yeah, hi everyone. I'm Benga Sadiq. I'm a project officer with the Food Price for Nutrition team here at Tufts University. And Tayo.
Hello everyone, I'm Olutayo Adeyemi. I am a nutrition consultant working out of Lagos, Nigeria. Thank you.
And over to Leah.
Hey everyone, I'm Leah Koslow. I'm also a graduate researcher with the Food Prices for Nutrition group and a PhD candidate at Tufts in Boston as well. Good to be with you today.
And we have Masters here who isn't listed on the slide, but glad that you could make it, and the PI of this project at Tufts. So Will, maybe you want to introduce yourself too.
Thanks so much. Yeah, and it's just really wonderful to see so many people and to hear how this progress has progressed, how the project has progressed. You're in for a treat now. It's really an extraordinary set of results you'll share and discuss with, I hope, lots of questions from you and comments, because it's a great opportunity to take stock of what's been done.
For the session today, first we're going to start with an overview. I will give an overview presentation of the cost of a healthy diet and affordability indicators and the project as a whole and where we've come from and where we're going next. Then Benga will give a short presentation on how to calculate the cost of a healthy diet, where we'll have a brief exercise to practice that. And then thirdly, we'll hear, I think the most interesting piece from my point of view is Dr. Tayo Adeyemi will talk about policy applications of the cost and affordability of healthy diet. That's what that acronym stands for, using actually several examples from Nigeria where there have been policy impacts already from using this indicator at national and subnational scale. And then we will end with a group discussion in breakout rooms on other potential policy uses of the indicators. So to start with where we came from, this work on using food prices for nutrition was always in service of this overarching vision, which was to be able to look at food security in a more holistic way that actually matches the definition that FAO and the UN agencies have used for the past 30 years, which is food security, meaning when all people at all times have physical and economic access to sufficient, safe, nutritious food to meet dietary needs and food preferences for an active and healthy life. And this work really started by seeing the disparity of how food security had been measured up until the last several years up until about 2015 as really only hunger and adequate access to calories, which clearly does not satisfy that complete understanding of what food security is meant to be, of access to nutritious food to meet dietary needs. That's much more than calories. So this project has actually been in 3 phases over a decade. We've done 9 years of learning labs here at ANH Academy. And the first phase of this project was actually an IMANA grant. The IANDA project, which stood for Indicators of Affordability of Nutritious Diets in Africa, was working only in Ghana and Tanzania to pilot these indicators and using food price data for nutrition. From that grew a next phase, another grant of Kandasa, which added South Asia. And then from that grew into this final phase of the project where we are now in food prices for nutrition, where we've been really focusing on mainstreaming the methods for looking at cost and affordability of healthy diets globally and supporting country work to be able to use these indicators. So you can see that in the project framework, where our purpose has been to scale up monitoring and analysis of food prices, to guide agricultural production and food markets for improved nutrition. So it's really hitting the ANH core of like, how do we improve nutrition and health through agricultural systems and food systems? But indeed, there are other solutions to lack of access to healthy diets than only through agriculture. So it also deals with social protection and food environments more broadly. So it's, we'll talk about those 3 areas in the policy section. And so within that overall purpose, our work has been to support the use of these metrics in high priority countries within the framework of this grant supported by Gates Foundation and what was UK Aid, now FCDO, to build a global system to monitor change in food prices for nutrition and also analyze changes in what's driving unaffordability of healthy diets. And as part of this bottom piece of actively disseminating, that's what we're doing here, making sure that everyone is aware of these tools and indicators that can be used in your work and understanding them when they're published globally. As most people here are probably aware, these are indicators that are published every year within the UN flagship report led by FAO, the State of Food Security and Nutrition in the World reports. The indicators of cost and affordability of healthy diet have been published since 2020, formally adopted by FAO in 2022. And these are calculated in collaboration with the World Bank, which also has used the indicators such as in the Atlas of Sustainable Development Goals, looking at SDG 2 on hunger. Again, speaking of that broader vision and awareness, it's not only hunger, we also need a healthy diet for a healthy life to achieve the broad zero hunger target globally. The data that have come from these global monitoring efforts, the collaboration with FAO and World Bank, they're published in FAO Stat under the cost and affordability of a healthy diet domain. And in parallel, in the World Bank Data Bank, in the Food Prices for Nutrition Data Hub. So these 2 outlets of the primary data are done in concert. So you'll find the same data in each of the FAO and World Bank databases. And our team has been tripartite from Tufts and World Bank and IFPRI, but we also have been very much in collaboration with FAO, as well as the country collaborators in the focus countries covered in this phase of work, which have included Nigeria, Malawi, Ghana, Ethiopia, Pakistan, and Bangladesh. So a large team of people, and thanks to Will for being here and leading these grants and all of the coordination needed to make this happen. It's been a real feat of coordination. And in the coming years, as this particular grant is coming to a close this summer, the work doesn't stop. The plan for coming years is that there will be scaled up technical assistance to more countries than just those that could be covered within a grant to be able to monitor the cost of a healthy diet as national statistics, as Nigeria does, which you'll hear more about. And also what we're focusing on today to explore further use of the indicators as a tool for policy analysis and action to improve food systems for healthy diets and nutrition. So that's the broad scope of kind of the big lift of work of how we've gotten to where we are. Now I'm going to go into the overview of the indicator itself, the cost and affordability of a healthy diet, and explain the basis of what it is so that we're all on the same page before we go into the activities. And the basic purpose of this indicator is to understand if you were to go into an average market in a given country, how much does it cost to purchase a diet that satisfies dietary guidelines? And how many people could not afford that? And this is really important for considering efforts of trying to change behavior for improved diets and nutrition. That having done field work in, especially in previous years in rural places, sitting in mostly groups of women who were receiving nutrition education, often it was really a question of can these women act on this information they're receiving to consume a diet that's diverse and nutrient rich and has a lot of different food groups? Can they actually do that? How are they going to afford those various components of the diet? How are they going to access them, both economically and within the food environment? So this indicator is really getting at the economic piece of, can people afford to act on information to consume healthy diets that meet dietary guidelines? So we do use dietary guidelines as the definition of what is a healthy diet. When we want to look at what does a healthy diet cost, we first have to define what it is. And we rest on the definitions of healthy diets that countries themselves have produced officially, which are food-based dietary guidelines. And these represent typically what should be consumed in a day for an average person. They focus on being realistic for regular people to be able to consume diets that both protect health against non-communicable disease, but also meet nutrient needs in general, both in terms of macronutrients, carbohydrate, fat, and protein, and as well as micronutrients, the vitamins and minerals, and to do so in a way that is dignified and culturally appropriate. So in nations where these guidelines have been elaborated, they do constitute the official policy standard of dietary needs, and they're often used for the basis of social safety nets and nutrition education programs. So when we looks like there's something wrong with the middle graphic. I apologize for that. But when we look at dietary guidelines that have been published across countries and analyze what are the proportions, what are the food groups that all of these different countries recommend, and in what proportions, we can look at the average across countries. And in doing that, we've come up with something called the Healthy Diet Basket, which is used as a global standard for reflecting the commonalities across national food-based dietary guidelines in terms of what food groups are needed on a daily basis and in what proportions. And so you can see here a few countries, their food guides, the way they depict it is very similar to what we've come up with as the average of quantities that are recommended, where about half of the plate looks like fruits and vegetables, about a quarter of the plate in starchy staple foods, and about a quarter of the plate in protein-rich foods from both animal and plant sources. And then a small amount in oils, added oils and fats beyond those which are already contained in the foods themselves. And to further specify what exactly this means in terms of energy content and diversity, because dietary guidelines universally recommend diversity, specifically within especially the fruits and vegetables food groups, but diversity overall. We don't just include one item per food group, but several. So for fruits, it's 2 items per day that we include for a standard of a least cost healthy diet. For vegetables, it's 3 items that gets you to your sort of standard 5 a day that's often recommended. For animal source foods, we include 2 items, and then 1 for legumes, nuts, and seeds, and 1 for oils and fats, and 2 for starchy staples. So we end up with a basket of 11 items as kind of a minimum standard of diversity, divided into the proportions in terms of dietary energy that correspond to what we just saw in the food guides and pie chart. And this comes out to an average of 2,300 calories per day, which is about the average dietary energy need across the population. It's also the dietary energy need for a woman age 30. So happens that that turns out to be the average across population groups in general. And so we can use this healthy diet basket as a global standard set of criteria representing commonalities across national food-based dietary guidelines for the purpose of calculating and comparing the cost and affordability of healthy diets across countries. I wanted to point out we just have a recent publication on this healthy diet basket. It came out a couple weeks ago in Nature Food. And if you want to dig into the details, we show that that we can use this healthy diet basket as a valid standard across countries because for various areas, it does represent well guidelines around the world. So it doesn't overestimate cost. It has a similar cost than other national dietary guidelines or slightly lower. When we look at the micronutrient content of least cost diets that meet this standard, we find that they tend to contain about 95% of the requirements for all micronutrient and protein needs, which is the same as when we look at individual national food-based dietary guidelines. And they also are balanced in terms of the macronutrients of carbohydrate, fat, and protein. When we look at whether they adhere to WHO recommendations for, WHO guidelines on the prevention of diet-related non-communicable diseases, such as not containing too much sugar or salt or processed meat and having adequate fruits and vegetables, et cetera, they do adhere to most of those recommendations most of the time. And importantly, they also are sustainable. So the carbon and water footprints of diets that meet the healthy diet basket standard are similar to those of the Eat Lancet diet. And to show this, you can see this in the paper as well, but just to show on the left side, we have the blue is healthy diet basket. This is carbon footprint, and then the bottom is water use. And the Eat Lancet is the green over here on the left, or sorry, on the right, mixed up my slide. On the right, we have Eat Lancet. On the left, we have Healthy Diet Basket. And you can see that they're very similar, and you can see where different countries' dietary guidelines tend to fall in the middle. So recognizing that sustainability does have a lot of different components, the ones we can most easily look at across countries are greenhouse gas emissions and water. And we can see that the standard we've been using for cost and affordability of healthy diet does tend to come out similar to other standards that have been used for sustainability or sustainable diets, most notably the Eat Lancet. So that's news we wanted to share. Now I've been talking about least cost diets that meet the standard, and I want to say a little more about what we mean by a least cost diet. For the least cost diet that meets the healthy diet basket standard or any food-based dietary guideline, what that means is that we have the same food groups and the proportions stay constant in all of the analyses in terms of the share of dietary energy for each food group, but the items themselves change, are substitutable, because whatever you find in the market that day, that's the prices you compare. And so going into a market during January in Malawi, you're going to get a certain set of items which are least cost. If you went into a market in July in Italy, you would get a different set of items that are least cost. And if you go in a different month, those items are going to change. So it's not hand picking a set of items. It's only keeping the food groups constant and their proportions constant. And the items themselves are whatever happens to be in the market at that time and whatever happens to be the cheapest. And so there will be seasonal differences in the items that are the cheapest at different times of the year. And so what we're looking at here is a lower bound of access, economic access in the market to healthy diets. If we were to add other criteria such as convenience, further preferences, individual preferences, or tastes, that would just raise the cost further. So this is really a price floor below which it's hard to purchase a set of foods that would meet dietary guidelines. The data that we use to look at this in the market is from the International Comparison Program, which is the only data set of food prices that exists currently across countries. It's maintained at the World Bank by the International Comparison Program. And these data are gathered from all the countries in the world, or most of them, from 173 countries in the most recent round every few years. And it's a massive effort to compare prices across countries. It includes 735 foods and non-alcoholic beverages. And then the ICP also includes other things that are not foods for the purpose of price comparison. But we use the food items. And as you can see, the last round was in 2017. So it's not every year, it comes every few years. In countries, other retail food price data can be used that are updated much more frequently. And we'll hear about that in Nigeria, where prices are often collected by governments on a monthly basis. And so this indicator can be updated frequently using the data collected within countries. At the global level, when we use that database of prices across countries held by the World Bank, what we find is that 2.8 billion people in the world cannot afford a healthy diet in the market. And so this statistic has complemented other food security indicators. It's many more people than those who are estimated to be hungry, lacking adequate calories. When you factor in access to healthy diets, the number goes up to 2.8 billion or so. Just to say a word on how we look at affordability, to be able to afford a healthy diet, total income must be equal to or greater than the cost of a healthy diet plus the cost of non-food basic needs. And so to determine what those non-food basic needs cost, in principle, we use the non-food portion of poverty lines. So it's already been determined, national poverty lines determine this is the level of income needed for food and non-food. We can take the non-food portion and add it to the cost of healthy diets. We don't actually have a database of those national lines across countries, so we do use the World Bank International Poverty Lines, and we look at the percent of expenditures on non-food among the poor. So for example, in low-income countries, the poor tend to spend 63% of their income on average on non-food. And so if we take that 63% of the international poverty line, which is $2.15 for low-income countries, it's different for higher income countries. So this is just talking about how it works. We can find that we would need to reserve $1.35 for non-food basic needs and can add that to the cost of a healthy diet to determine the level of income needed to afford a healthy diet, and then compare that to income distributions from household surveys. So in a nutshell, that's how the affordability calculation works, which results in the statistic of how many people around the world could not afford a healthy diet. So now to go into the calculation, I'm going to hand over to Benga, and then we'll have, after his presentation, some questions and be able to go into the group work.
Yeah, thank you, Hannah. Hi, everyone. So now I will show us how to calculate the cost of healthy diet. And in the next few slides, I will use an example of one food item to show and walk through the calculation for the cost of a healthy diet, and also, and then we'll do a brief exercise afterwards. Like Anna mentioned, there are a few things that we need to calculate the cost of a healthy diet. The first is a reference for what a healthy diet is, a quantified reference to define a healthy diet. And I talked about the healthy diet basket, which is one of the ways that we use to define healthy diets to compare across countries. Like Anna said, it represents commonalities across many countries' food-based dietary guidelines, but we could also use the national food-based dietary guidelines. Many countries have their own diet references to define the healthy diet standard, and that could also be used. From the healthy diet standard, we generally need three categories of information. First, the food groups. In the case of the healthy diet baskets, we have 6 food groups, and I talked about that in great detail. The second category of information we would need from the healthy diet basket are the number of foods recommended within the food groups. So, for example, 3 vegetables, 2 fruits, 2 starchy staples. And the third category of information we need from that is the number of calories required within those food groups. And this data is what we use to quantify the standard for what a healthy diet is, and then calculate the cost of that standard. The second category of data we need are the food prices. So there are 2 main sources or category of sources for those food prices. We could get from the international comparison data from the World Bank, which Anna also talked about, or we use country level food prices. The main difference between these two is that the country level food prices have more local food items, and we'll see from some of the examples how this is so, and they're usually monitored more frequently. So from this, we need the price per unit sold in the local market. So for each of the food items that we are monitoring, we use the price per unit sold to calculate the cost of a healthy diet. And then the third category of data that we need is the food item information. Primarily, we need the edible portion of food and the energy density. We have this done across different food composition database and extracted from different food items. So in the cost of a healthy diet toolkit, which we would show you later, there's the food item information database, which has information for most of the food items that you would need to calculate the cost of a healthy diet, and it has the edible portion and the energy density. The edible portion is basically the part of the food item that is safe and intended to consume. It generally changes depending on culture and food item, and it helps us to exclude parts of the food that are not consumed, because again, the goal of the cost of a healthy diet is to determine the least expensive cost of food to meet a dietary reference. So we try to focus on the actual cost and get rid of the inedible parts when calculating the cost. So I would itemize the steps for calculating the cost of a healthy diet, and then show an example of that. The first step is to calculate the price per kilogram for each food. When we collect the food prices, they are usually in price per unit. So if it's milk, for example, it's the price of 1 liter of milk or 1 gallon of milk as it is sold in the market. If it's eggs, it's the price of 1 crate or a dozen of 1 piece of egg as it is sold in the market. So to standardize that across all the different food items, we calculate the price per kilogram of each food. The next step is to match those food groups to the food composition in the food item information database. Like I said earlier, we match those food items to determine their edible portion and the calorie content or the energy density of the food item. The third step is to calculate the price per calorie of each food. And then we categorize each food into the appropriate food groups using the healthy diet standard that we're using to calculate. So in this case, it would be the healthy diet basket as the standard. So we have 6 food groups, and we'll calculate the food items into each of those 6 food groups. The next step is to then calculate the cost per day for each food using the number of calorie required for each food item within each food group. And then we drop duplicate items. The reason why we do this is because, again, remember, we're trying to select the least expensive food items within each food group, but we're also trying to ensure diversity of food items within the food groups, like Anna mentioned. So for example, if in your food price data, you have different variations of rice, if you would select only the least expensive rice, so that we are not having under starchy staples rice and rice. So instead, you'd want to have rice and a different starchy staple, maybe maize or some other type of starchy staples, some tuber that's available. So with the step 6 is very important to drop the duplicate food items and only select the least cost item within each variation of food items and then within the food group. So then step 7 is to select the least expensive food items within each food group. So depending on the required number of items for each food group, as we showed in the healthy diet basket. For example, if you are for oils and fats, we select the least expensive oils and fats. For fruits, we select the 2 least expensive food items, fruits. For vegetables, select the 3 least expensive items, and so on. And then we sum up the cost per day for all the food that has been identified as least cost within each food groups. And that's how we calculate the cost of healthy diet. So I would show an example with eggs, and I would just try to walk through how we calculate the cost of healthy diet using one food item, eggs. So say you go to the market to buy one piece of egg, and this is very hypothetical data. It's not for a real country. And for one piece of, if egg are sold as 1 unit, so 1 unit of egg is purchased for 0.66 currency units. I'm just going to say dollars because that's where I am. So the information you get from the raw price data is the price per unit of 1 unit of whatever food item you bought. You get the item weight, so you weigh the food item itself. If it's just 1 unit of eggs, then we have that to be 0.044 kilogram. And then the unit it is sold, in this case, it's just 1 single piece of egg sold for 0.66 currency units, and it weighs 0.044 kilograms. So this is the raw data that you get from the market when you buy the food item. So the first step is to calculate the price per kilogram, like I showed. And to do that, you simply divide the price per unit by the weight of the item to get the price per kilogram for that food item. In this case, we've done that to show, so the price per kilogram for egg is 14.93 currency units. And then step 2 is to calculate the price per kilogram of the edible portion of eggs. So remember, we don't consume the entire eggs with the shell. We have to remove the shell and then consume just the eggs. So we get the information about the edible portion of egg from the food composition data, which is in the food item information data, the food item information database. And we know that to be 0.88 kilogram of egg, which means that roughly about, for every 1 kilogram of egg, about 8% of it is consumed. Then 12% of it is assumed to be the shell, which is not consumed. So the price per kilogram for the edible portion of egg is now 13.14 currency units, which is slightly less than the price per kilogram of the entire egg, which we got from the market. Then the next step is to calculate the price per calorie. Again, to do this, we go back to the food item information database to get the number of calories that is contained in 1 kilogram of egg. Since we know that 1 kilogram of edible egg costs about 13 currency units, and from the food item information database, we can get the approximate calorie content of 1 kilogram of edible egg to be 1,430 calories. And then we calculate the price per calorie to be 0.012. After this, step 4 would be to calculate the cost per day to meet the food group recommendation. Now, to do this, we again go to the dietary guidelines, which we showed earlier. So I'm just going to come back to this slide very quickly to show the dietary guidelines and explain. So we know we categorize eggs to be an animal source food, right? And from our diet reference, animal source food, we need 2 number of foods within the animal source food group to give us 300 calories, which would mean that to calculate the cost per day for just eggs, we'll divide 300 by 2 because we need 2 animal source foods to give us 300 calories. So if egg would be one of our least cost items in the healthy diet basket, then we need 150 calories to come from eggs. And we've calculated the price per calorie of eggs to be 0.012 for 1 calorie. So simply multiply that by 150 calories for eggs and for that food item in animal source food, because egg is one of the items that would be in animal source food. We need 2 to give us 300 calories. So if egg would be a least cost item, it will supply 150 calories. And then we can now calculate the cost per day to meet the food group recommendation to be 1.79 currently. If we have 100 different food items, we simply calculate this 100 different times for all those food items to get the respective cost per day. After doing that, we then identify the least cost item within each food group for all those items. So this is an example of the final product of your analysis after doing this calculation that we just did. Of course, not manually, but when you do this for all the food items in your data, then you identify the least cost items for each of the food within each of the food groups. And then one thing you would notice very quickly here is eggs are not here in this because we calculated the cost per day for eggs to be 1.78 in that particular location. And we have other food items in the animal source foods which are cheaper than that. So those are what are selected to be part of the healthy diet basket and the final cost of healthy diet calculation. The other thing I just wanted to quickly show is why we had to divide 300 by 2 to get 150, which we do for all animal source food. So you can see that then the cost to purchase 300 calories of animal source food, which is what the healthy diet basket recommends, would be the addition of the 2 food items within the animal source food category. So in this case, that would be sardines and milk to give us the 300 calorie. And we did the same thing for starchy staples, oils and fats, vegetables, fruits, and legumes. So of course, this calculation will not be done manually. The Food Prices for Nutrition project has these toolkits available, and I would show where you can download them shortly. And when you put in your food price data, you are able to generate all of this calculation automatically. But then you can see just from the example data set, this is eggs that we just calculated, and we have the daily cost, which is, so we have the price per unit 0.6, we have the price per kilogram, which we calculated, and then the daily cost, the cost per day. So I think that brings us to the end of this part of the calculation. If you want to see, if you are interested in doing this calculation yourself, you can scan this QR code or go to the website to get the full toolkit. We have a version of the toolkit in Excel, in Stata, and in R. We also have a sample data for you to practice this calculation. And like I said earlier, it contains the food item information database, which has the edible portion and calorie content for more than 500 common food items that are usually contained in different price data sets. It also has instructions. It has video instructions. It has manual instructions for you. And you can always reach out to us if you have any questions on when you want to use this to calculate cost of healthy diets. So we will go into an exercise very quickly, but before we do that, I would explain what we'll be doing in the exercise. It's essentially, we have a set of data that has been pre-calculated with the cost per day. And all we need you to do is to identify the least cost items within each food group for those food items. And to do this, we'll go into breakout groups, and we have an exercise sheet for each group to use. I will show a demo very quickly, what exactly is expected in this exercise. So this is a sample data where we have calculated the cost per day, which is the calculation I just walked us through, for multiple food items in a particular market at a particular location. So we're just going to assume this is one market in 1 month, and we have different food items. So rice, corn, pasta for starchy staples, oils and fats for all the food groups within the healthy diet basket, which we'll be using as our reference. So the healthy diet basket, again, it's here, our reference. We need 2 starchy staples, 1 oil and fats, 3 vegetables from this data. So to complete this exercise, we're going to scan through each of these, we're going to scan through the data and then select the least cost item to calculate our cost of healthy diet. So I'm going to do for starchy staples, and then you can continue the rest in your group. So, and maybe we can try to do this together. So if you scan through starchy staples and try to identify the least cost, again, remember, we started with the price per kilogram or the price per unit in our calculation, but then what we use to identify the least cost is the cost per food per day. That's the daily cost per person after accounting for the edible portion, after accounting for calorie content, and after accounting for the requirements within the healthy diet basket reference. So in this case, I think rice seems to be the least expensive starchy staples. So that'll be rice, 0.17. And then the next least expensive seems to be wheat at 0.2. So we have wheat, 0.20. And then we go on for oil and fats, vegetables, fruits, and at the end we calculate the final cost of healthy diet for this market at this location. If that is clear, I don't even have like a minute or two if we have any questions, but otherwise we can go into the group chat, into the breakout groups, and we'll have facilitators there to assist you to complete this exercise. Hello everyone. How was the exercise in your group? Oh, fantastic.
It was good.
Yeah, we had some very interesting like questions and conversation in ours as well. I just went through and it looks like we all got 2.69 as the cost of health diet in that hypothetical market at that time. So we have a few minutes for, I think we have like 2 minutes for some questions before going to the next session. So if there is like anything that really stood out in your group that you'd want to address or like share with everyone else, I think that would be a great time.
Yeah, thanks. I wanted to ask a question as regards your presentation. Maybe I wasn't too clear as regards aspect, but I heard you mention things about you calculate more about the example of the egg that you look at the LTV portion of the egg, and that is what formulates or constitutes the calculation for the egg, for the price of that part of the egg. But in the instance of I don't know, when people are purchasing in the market, they don't get to buy the edible portion, they buy everything at the same. So how does that account for, is that a true reflection of the price you're paying, or is only concentrated on the edible portion, which nobody exactly buys only the edible portion for those certain food items? I don't know if you could clarify as to that. Thanks.
So it was really hard to hear you, but I think you're asking why we're calculating for the edible portion and not the cost of the entire meal. And I think the reason is because, like we were explaining in our group, the cost of healthy diet is the minimum cost to meet the dietary guidelines for health. So we're focusing on how much of the food is consumed to meet the healthy dietary guidelines. And because the dietary guidelines calories consumed, we have to calculate the cost of calories consumed and not the cost of the entire meal. So that's why we account for the edible portion and then account for the calories of that edible portion. I think we can take one more very quickly because I see several hands on.
Good afternoon. Can you hear me?
Yes, we can.
My question, I want to ask that does the cost for a healthy and affordable diet take into account the differences in market prices across country? Like, for example, in Nigeria, even within a particular like locality, the different markets have like different market prices, not to talk of like within the state and within the country. And also, does the calculation take into account the volatility of prices across country? Because I know you're Nigerian, and you know if there's one issue we have in the country is that we don't have price control. So today you could go to the market and a crate of egg is 5,000. Tomorrow you could go and it's 6,000. So how does this calculation account for these sporadic changes within prices of food commodities?
That's an interesting question, and I think some part of the next presentation will address that, but do you want to quickly address that question?
Yeah, so I think the basic idea is that in terms of the cost of a healthy diet, it's helpful to be monitoring the cost of a healthy diet regularly to be able to capture those differences. So in Nigeria, the government collects prices every month across a very large number of markets. I think, Tayo, correct me if I'm wrong, it's something like 10,000 markets, in order to capture the variation each month and across all of those different places. And then that data feeds into the cost of a healthy diet calculation. And because there is so much variation, we want to be able to monitor it as opposed to just looking at one point in time and making decisions. So for example, in Nigeria, the Bureau of Statistics puts out a monthly bulletin for that purpose. And it is very helpful to be able to look at seasonality and also geographic differences, but that's possible when the data is collected regularly, which is true in most countries of the world because inflation is monitored. So when that data is available, that's very helpful. Many other people have looked at the cost of a healthy diet using like a single time point because that's the data that they have. But your point is excellent, and it's really important to be able to see that variation. So I hope that answers the question, but other people should add if I'm missing something.
So I want to paint this issue in a real life situation. Imagine me, I went through the records and I saw that this is how much I need to take to the market in order to buy a healthy diet. So after going through the record, I calculate my money. When I get to the market, I realize that I'm actually paying more than what I saw on the record. So how do we address that in that regard? I understand that we are trying to also calculate the calories in order to capture the healthy diet, but we're also trying to talk about the prices in the market. And in the market, we also buy this unedible portion of the food too with our money. So how do we address that issue? Thank you.
I think this is a question again about edible portion. So there's been some clarifications in the chat. So just to say, like, if you imagine, an animal source food that has shell or bone, that's 25% of the total. So you have 75% edible, 25% inedible. If we want to know the cost of the amount of a certain amount of egg, which has a shell that comes with it, say that shell is 25%. We have to find the cost of 125% of the item in the market to account for the fact, that some of it is inedible. So I'm doing this sort of example on the fly, but just to illustrate the principle, we have to get the cost of more than the total amount needed that's edible to account for the inedible portion that we do have to purchase. So it's factored in.
So I think one of the things Jemima was also trying to understand is the cost of a healthy diet versus how much you take to the markets to actually buy something. And so what I understood from one of her questions is that if you say, oh, this is the cost of a healthy diet, and she takes that amount to the market, well, but she's unable to buy a healthy diet because the price has changed. And I just want to say that the cost of a healthy diet is the least cost. It's not the cost based on how the sellers in the market will sell their goods. So for instance, based on the cost of a healthy diet, the amount of calories you need to consume from maybe a fruit, or let me use bananas, for example. So bananas are sold in bunches in a place like Nigeria, but the cost of the healthy diet may just require you to consume 2 bananas. You're not going to go to the market to buy 2 bananas. So you cannot use the cost of a healthy diet to say, this is the food budget I'm going to spend in a particular day. It is a guide to say, this is the least amount you can spend to consume a healthy diet. But then you have to take into account how are these things actually sold in the market. So you may need to buy maybe for 5 days at a time because that is what the seller will sell. So the cost of a healthy diet is a tool to help you know what is the least cost, but it doesn't reflect what you will buy in the market, like how your purchasing behavior or how the sellers will sell in the markets. So you can't use it for that decision in a sense.
Well, maybe just to further clarify, like what you're saying, Tayo, is like because items are sold in bulk and you don't buy 1 banana at a time, you might have to buy 5 days of a healthy diet. But if you divide it by 5, that's still going to give you the cost of a healthy diet. Like it is meant to reflect the cost per day per person for a healthy diet. But the reality is that maybe you have to buy in bulk for several days at a time. And so it's dividing that by the number of days to get what is the cost per day per person.
Yeah, I think we can go to the next presentation now. So we have Olutayo who will take us through some of the policy applications of this metric in Nigeria. And afterwards, we'll have a group discussion. So over to you.
Okay, so thank you very much, Benga, and hello again, everyone. So yes, I'll talk about how we have used the cost of a healthy diet in Nigeria. And I would say before I start that a lot of the work I'll be talking about is work that I've been involved with while consulting for the Global Alliance for Improved Nutrition in Nigeria, supporting the Ministry of Agriculture and also the Ministry of Budget and Economic Planning. And so for Nigeria, the work on the cost of healthy diet has been led by the Ministry of Agriculture and Food Security and the Global Alliance for Improved Nutrition. And the motivation for tracking the cost of a healthy diet was because we realized that there were data gaps. So there have been assessments that were done to say, in understanding nutrition challenges, food security was one key aspect that we didn't have a lot of data about. And for the Ministry of Agriculture wanting to implement nutrition-sensitive food security, nutrition-sensitive agriculture interventions, the lack of data was a concern. And so when we learned about the code, and I'll talk more about how we learned about it later, we decided to monitor the code because it allows us to see food security better and also how financial influences may be affecting food choices. And it increases our ability to track what is happening for food security, also increases our ability to target resources and develop policies. And I'll talk about how policies have actually been developed based on the cost of a healthy diet. And so this has already been alluded to, but when you have the cost of a healthy diet and the affordability of a healthy diet, it provides a framework for diagnosing the causes of poor diets. and it also helps you to target responses. So for instance, if you have poor diet, it could be because prices are high, and so people cannot afford even the lowest cost healthy diet. And so once someone cannot afford the lowest cost healthy diet, then the person cannot consume a healthy diet. There's nothing you can do about it. And so in such a situation, you have to improve the supply to reduce costs so that the person will actually be in a position. And most of the time when we calculate affordability, it does take into account people who produce their food. So when we say people can, the cost is high and people cannot afford it, it takes this into account. And then you can also have low income. So really, it's not the cost that is the problem. It's just that people have, their incomes are low for any food at all. And in a lot of cases, maybe they cannot even afford to consume adequate quantities of starchy staples. So in such a situation, the cost and affordability of healthy diets can allow you to identify if this may be happening. And so in this situation, you have to work on improving livelihoods, earnings, and safety nets for people who cannot afford the lowest cost items. And then you can have a situation where people can afford the lowest cost items, but they are still not eating a healthy diet because they are consuming more expensive items. So for instance, you may have a situation where the least cost healthy diet, that's often the case in Nigeria, the least cost healthy diet never includes rice, it never includes beef, because they are cheaper alternatives in their food groups. But people prefer to consume rice and beef. And so by consuming those things, maybe they don't consume vegetables or they don't consume fruits. And so in the case where low-cost healthy foods are being displaced by more expensive ones so that people cannot consume a healthy diet, or they are being displaced by even less nutritious items like sweets, foods, for instance, one of the decisions that can be taken to improve healthy diets is to limit the consumption of the unhealthy foods. And so when Anna was presenting, she talked about the global monitoring for CORD, the cost and affordability of healthy diets. But in many countries, we need more granular data to understand the in-country variation in cost and affordability of healthy diets and be able to diagnose better and sort of like contextualize interventions. And so this is what has been done in Nigeria. Every month, the cost of healthy diet is calculated for rural and urban areas in each of the 36 states of the country, as well as the Federal Capital Territory. And this calculation is done by the National Bureau of Statistics. So on the right side, you can see just the cover of one of the cost of healthy diets bulletins that is published by the National Bureau of Statistics. And this work was supported by the Global Alliance for Improved Nutrition. So they also appear on the cover. And the data that is used for this calculation is monthly price data that the Bureau of Statistics collects routinely to calculate the consumer price index and data about inflation. And in case of Nigeria, we use the healthy diet baskets because we don't have quantitative food-based dietary guidelines nationally. For affordability, the most recent available data is from the 2019 Poverty and Inequality report, so from the Nigeria Living Standards Survey. And so we were able to compare the cost of healthy diets to household food expenditures using that survey. But other ways in which it has been compared is to compare it to the minimum wage. And so to just quickly go over the timeline of how we started to calculate the cost and affordability of healthy diets. It actually started from an ANH learning lab in 2018 in Ghana. So people from the Ministry of Agric, I was there, I was at FAO then. And so just a bunch of people, we attended this learning lab and we're like, oh, this is great. The food crisis team or the TOPS team was supporting Ghana to calculate, and I said, oh, let's reach out to them and see what is possible. And that was how the journey started. We reached out to them. They told us what we needed to do to be able to calculate it. And the Ministry of Agri people took it to their minister to say, please talk to the Statistician General. We want this to be done. And because it's government, it took a long time. We had a lot of processes. While we were working on it, we collaborated with researchers at Wageningen. They used the survey I mentioned earlier. It also includes food prices. So they calculated the code with survey data, and they also calculated affordability. And the results showed that even though the costs were really low, it was like 200 and something naira, which for the average Nigeria it seems so ridiculously low. But then a high percentage of people couldn't afford it, up to like 89% in some states. And so that became a bigger advocacy to when you present that to government, they're like, no, how can it be 200 and something naira and 80 something percent of population in some states cannot afford that? And so the government became more interested in taking it up. And right from 2021, it became a tool that started to influence policy. In 2022, we obtained historical data from MBS so that we can understand better seasonal trends. And then we started working with MBS. So when I say we, it's really tough, like the food prices for nutrition team, GAIN, and Ministry of Agri working with the National Bureau of Statistics to calculate the code. And by 2023, the Statistician General had approved that MBS will report monthly. So we're even expecting maybe they'll say, oh, quarterly, but they said, no, we're going to do this monthly. And they've been consistent about it, I think from about October 2024 and 2023 to December 2024, the reports are actually available, they're online. This year, beginning 2025, they changed the number of items they collect prices for this. So they started a new price list. And so they've actually calculated for like 3 or 4 months this year, but it's not yet up on the website. And so I would go over these different ways in which the Bureau of Statistics has, in which Nigeria has used the data from the costs and affordability of healthy diets to influence policy. So I mentioned that you can use it if there are high prices, then there are decisions you can take. If there's low income, there are decisions you can take. And in Nigeria's case, we've taken decisions based on these two things. We found high prices, we found low income. But we've also seen displacements, but the aspect about displacements is still a planned decision. So I'll talk about how we plan to use that data. And then the data is also being used to improve food systems performance and governance. So to track food systems performance and governance. So in terms of high prices, so when in 2021, the data I said, when COD was calculated with the survey data, we could show the government that, look, this cost is really low, but so many people cannot afford it. And the numbers were clear. Even when you use minimum wage, it was clear that affordability was a problem. And the government was developing the National Pathways to Food Systems Transformation for the UN Food Systems Summit at that time. And so considering that the data about affordability, one of the priority interventions for them, and it's still a priority intervention, included in the pathways, is what they call Operation Feed Yourself. And so the government is providing a lot of support to states, to local governments, to support people to grow home gardens, and if possible, to also have like maybe poultry to produce eggs just for their own household. So not as an income generating activity, just something where people can have vegetables and don't have to buy, so that increases their ability to achieve a healthy diet. Like it increases supply or improves supply for the household. And then another activity that is ongoing, and this was done by the World Food Programme. So separate from the work that was being done with the Bureau of Statistics and Ministry of Agriculture, the World Food Programme also uses the cost of healthy diets and some other related metrics. And so they worked with the Bureau of Statistics as well separately to collect price data in 2021. And then they calculated what they call the affordability gap. And the affordability gap is based on the difference between household income and how much the household would require. So on the average, how much the households will require to achieve the cost of a healthy diet or cost of a nutritious diet metric which they used. And the household income. So what was the gap? And so based on that affordability gap, then they came up with how much needed to be provided to households in cash transfers for social assistance, or if you were going to give food assistance, then how much food you needed to give. And this graph here just shows some examples of some states. So it shows the food expenditure, which is how much the households normally spend on food, which is based on their income. And then it shows in this case, they accounted for cash transfer that they were already receiving, and also so base cash transfer and top-up cash transfer. And it showed that despite what was existing, that there was still an affordability gap, that households in vulnerable households were still not being able to, there was no way they were going to be able to achieve the cost of nutritious diets. And so that has led to changes in social protection baskets. And then we have so all of this happened before the Bureau of Statistics started to report the cost of healthy diet. So this was 2021, 2022. The World Food Program report was published in 2022. And then from January 2024, the Bureau of Statistics started reporting the cost of healthy diets. So prior to then, it was just policymakers in the Ministry of Budget and Planning, Ministry of Agriculture, even states. So we had done advocacy to states. And so policymakers in those states knew about it, but it wasn't an indicator that was known by the general public. But when we had this, the launch of the reports in January 2024, there was a press release along with the launch. And after that, every month when the Bureau of Statistics would publish these reports, the media would take it up. And every month there'll be like several media outlets that will report that this is the cost, it's too high, people can't afford it. There's this one, Nigerians face malnutrition as cost of healthy diets hits 1,030 or something like that. So it generated a lot of media attention. And so that increased also the policy use. So it became an indicator that the Nigeria Governors Forum that holds governors of each state accountable, they started to use it as an accountability. It's an indicator for holding the governors accountable. So they published the National Nutrition Scorecard, and they added the cost of healthy diet as an outcome indicator. So this is an example of a scorecard for one state. And the cost of healthy diet is there as an outcome indicator. And essentially when they report, so for all states so far, they started reporting this in 2023. So the scorecard is published once a year. And when they report this, they just highlight the fact that the red means that benchmarks are not being met. And in this case, it's showing that the costs have been rising. And is essentially tracking performance of states in facilitating food security. So if your state isn't improving, then as a governor, you know that, okay, this is something that my administration is not doing well in. And so, and of course, particularly when you have some states that are green, so they are green for some indicators. They also have a summary sheet where they summarize all, like just put red or green or black for all the indicators for all the states. And so when you see other states doing well and your state isn't doing well, it's like, oh, everybody's going to know that I'm not doing a good job. And so it helps the governors to think more about deliberate actions they can take to improve food security and nutrition. And then the big one that also happened was that when so many macroeconomic changes happened and with the media outcry that people couldn't afford a healthy diet, so the government said, okay, and then Nigeria was due for a change in minimum wage. And so the government reached out, the presidency reached out to the Bureau of Statistics to say, what should we consider in setting a new minimum wage? And the Bureau of Statistics said, oh, you have to consider the consumer price index as well as the cost of a healthy diet. And when the negotiations started, both the media and the labor, particularly the cost of a healthy diet. So every time then they will say, oh, but the Bureau of Statistics says you need at least this amount to get a healthy diet, and it's not going to be possible with this proposed minimum wage. And so the negotiation continued, and from the reports we had, the minimum wage would have been set lower than what they agreed on. So it's currently higher than what the government wanted to pay and lower than what the Labour wanted it to be. But there was this media outlet that published that it wouldn't have been as high as that the cost of a healthy diet essentially influenced the negotiations such that they had to take it that high, because it was clear that people will not be able to afford a healthy diet. Even one person will not be able to afford a healthy diet on the initially proposed new minimum wage. And so some of the things we are planning to use it for is to identify inefficiencies in food supply chains to inform agriculture policy and trade policy, and also to enhance development of national food-based dietary guidelines that we are planning, as well as enhance how we frame our messages for nutrition education. So I'm almost out of time, so I'll just pick a few slides to show some data about how the cost of healthy diets may be able to inform these decisions that we plan. So first of all, you can see here how the cost of a healthy diet increased nationally in Nigeria from 2016 to 2024. It increased by more than 5 times, particularly between 2023 and 2024, it doubled. And one of the things that analysis that was done was to compare the cost of a healthy diet to the food price index, as well as the general sorry, I was going to move. Okay. Yes, so to the food consumer price index and the general consumer price index. And what the data showed is that from 2016 to 2020, the cost of healthy diets did not rise a lot, despite the fact that there was overall inflation. And then from 2020 to 2023, the cost of healthy diet was rising parallel with the overall inflation. But since August 2023, the cost of healthy diet has been rising much faster than overall inflation, and also more than if you use all the foods in the basket, that's more expensive foods as well as least cost foods. And what this means is that the cost of the least costs items, so the cheapest items in a sense to achieve a healthy diet, that cost is rising faster compared to all other foods or goods. So from 2023 August. And the other thing we've seen is that it varies across states, like it varies widely across states. So you may see states that are neighboring and you have the costs of healthy diets almost double. And so one state being almost double in neighboring states. And so what this information showed us, so one of the things we did was look at, okay, which food groups were driving the significantly higher cost, and vegetables and animal source foods are consistently food groups that are like there's a lot of variation. So some states are very cheap and in some states they are more expensive. And so using this data, looking at where items are cheaper and where items are more expensive, provides some indication of how we might want to change either cultural policy or trade policy, so distribution. And then we compared rural and urban areas of the same state. So within this state, now Kwara State, for example, what you see is that avocados are more expensive than in rural areas. So this graph is the difference between urban and rural. And so avocados are more expensive in urban areas than in rural areas of Kwara. But if you look at guavas cost nearly the same in both states. And then you have a situation whereby even though avocado was cheaper in rural areas, they are more unavailable in rural than in urban areas. So when you look at the number of months where avocado was unavailable in rural areas, then it becomes you have avocado unavailable more months than if you looked at it in the urban areas. And so, and this analysis looks at rural and urban areas of the same states. And so again, also reflecting the fact that there's a lot more to be done with preservation as well as distribution. And then if you look at that one, the one where we talk about displacement, so are people eating less healthy diets, like displacing low-cost healthy diets for less healthy diets? And the thing, as I mentioned, if healthy diets are unaffordable, then educating people will not be effective because they can't afford it, and that's the end. But you have some states, so like these states now highlighted in red, where the ratio of the cost of healthy diets to the food expenditure, so that's the amount they're already spending on food, is less than the cost of a healthy diet. And so people in these states can easily consume a healthy diet because they don't even have to spend up to their regular food budgets to consume a healthy diet. But the dietary intake data shows that people are not consuming a healthy diet, even in these states where the data shows they can afford it. And what it means is that rather than consuming least cost healthy diets, people are consuming their preferred diets that are not necessarily healthy, but are more expensive. And so looking at the Global Diet Quality Project data that shows consumption of animal source foods and legumes, nuts, and seeds, we see that legumes, nuts, and seeds are inadequately consumed, but animal source food a lot more consumed. So it's the magnitude of difference is a lot. And so when we look at this data, it tells us that people can actually improve their diet quality by reducing their consumption of animal source foods to within the recommendation and shifting the amount of money they would have spent on animal source foods to legumes, nuts, and seeds. And so to conclude, we found the cost and affordability of healthy diet metrics to be important tools for tracking change and guiding action for universal access to healthy diets. When we have the within country variation in cost and affordability, it helps us really see where some of the challenges are. For Nigeria that has a high malnutrition problem, it helps us see how much food security is a challenge and contributing to the problem. And it also helps us see that it's not just so it's not just high prices. So it's high prices and it's low incomes. And so for addressing high prices, when we look at variations in costs across food groups, across months, across states and rural and urban areas, we realize that there are interventions that can be done even within the existing situation of the country to say, okay, this is cheaper here. How can we increase efficiency in distribution? And then when we look at the wages too, it's informing things like minimum wage and social protection. And then for the addressing displacement of healthy diet. So when we are able to say, okay, this population, they can afford it, but they are not consuming a healthy diet. So because the healthier items are being displaced. And so that is also helping us to know which population can benefit the most from education and other interventions to make them make healthier food choices. Thank you very much.
I think it's time to conclude the session, unfortunately. I want to thank everybody for being here. I want to thank the Food Prices for Nutrition team and Tayo for a wonderful presentation. I learned a lot as I do working with you all. And I wanted to share a quick opportunity. If you're interested in food access, if you're interested in the cost of a healthy diet, we talk a lot about this in the research community on food access, which is part of ANH Academy, the Research Communities Initiative. It's a smaller group of ANH Academy members who meet monthly to talk about these kinds of things. So I put the link in the chat. It's free to join. And I'd hope to see more of you there. I know a few of you are members, which is great. And we'll share more resources from the Food Prices for Nutrition team on the webpage for this learning lab and the recording as well. So thank you all again so much. This is a great session. And I hope to see a few of you in person in Dar es Salaam for the research conference next week.